Hey guys, I'm John Kwan and this is Matthew Shahab. We're both doctors of physical therapy at Core Performance PT. Today's segment is on shoulder range of motion in a supine position using a cane. So this exercise is really good for patients who have limited restrictions or limited mobility in their shoulder. Now that could be because of post-operative conditions. It could be due to capsular restrictions if you have like a frozen shoulder. So again, this is a great starting way to really get that range of motion back into your shoulder, your glenohumeral joint. Again, I want to kind of throw caution to the wind. We want you guys to feel a stretch, but we also want you to be really discerning of pain. Now there's two types of pain. There's pain that's really intense and aggravating, and there's pain that's related to your capsule stretching and breaking up. If you are a little bit confused, please consult with your healthcare provider, your physical therapist. All right, to start off with, we'll start with the easy shoulder press, okay? So again, you can use a cane, you can use an umbrella, you can use a golf club, whatever you got at home, a broomstick. But basically, grip shoulder width apart, extend your arms up toward the ceiling, really try to engage those scapular muscles as well too, and breathing rhythmically. If you want to, engage the abdominals as well, a great, two-part exercise. Good. Next, you want to progress into shoulder elevation or flexion. Good. And you can do this in an overhand position. If that doesn't work, try the underhand position as well. They're both, great. Okay, notice that his shoulders or his arm position is a little bit more wider than his shoulder width, and that's going to open up the shoulder rather than closing it down. Good. Again, keeping the abdominal stabilized, breathing, and you want to kind of ease into the motion. Don't, have this herky-jerky aggressive movement. Your shoulder is very sensitive to pain, so you want to make sure it's controlled. Excellent. Then you want to go into the Scaption position. So he's cupping the ends of the stick in the palm of his hand, and he's going into more of a diagonal position. We call that Scaption or quadrant. And again, utilizing the opposite arm to drive the force, feeling the stretch into his shoulders, and really, feeling the opening or the lengthening of that shoulder joint. Great. Next, we want to go into your shoulder abduction series. Again, hands on opposite sides of the stick. And then just gently mobilize the shoulder. You don't want to be too fast because you want to really feel or identify what your body's telling you. Are you feeling a stretch or are you feeling a restriction or a pain? You want to feel that stretch. You want to feel things really kind of expanding or lengthening. Okay? Great. And next you want to go into that external rotation position. So you want that arm next to the body, hand or the cane inside the palm of his hand. Utilizing the opposite arm to drive that force down into that external rotation. Common compensation is your elbow to flare out to try to keep it tucked next to your body. Again, there's different ways of doing it. You can go into more of a dynamic movement, but feel free to have some static holds. So notice how Matthew is breathing and he's pushing the cane into that resistance and allowing the shoulder muscles to relax and getting that deep stretch into the joint. Good. Again, you can hold it for 5-10 seconds. The longer you hold it, the better. Whatever you can tolerate. Typically, I recommend about 10 repetitions to start off. You can progress to 2 to 3 sets as needed. More importantly, you should notice is that your range of motion should improve the more you are consistent with this program. All right, thank you very much. See you next time.